So hi guys, I'm just back from the hospital and I saw such a beautiful case today. So this was an 8-month-old child. The mother brought him with a recurrent history of diarrhea and ear pain, a lot of ear infections again and again. Okay, so as soon as the child come, what will you do? You'll do a CBC investigation, and the CBC was done. A recurrent infection in a child, we usually do a lymphocyte subset. So we did a lymphocyte subset by flow cytometry, and what did we found? We found that there are no B cells. So can you see the CD20 CD19 plot here? No B cells, but T cells are perfectly normal here. So this this was a very suspicious finding. So immediately we asked the patient for the immunoglobulin levels, which were, we saw the report, they were extremely low. So you saw, what is this case? This is a very typical case of Bruton agammaglobulinemia. So in Bruton agammaglobulinemia, B cells are not formed properly because there is a defect in Bruton tyrosine kinase. So when B cells are not formed, plasma cells are not formed. No plasma cells means no antibodies, isn't it? So when there are no B cells, there is nobody to go to the germinal center. Okay, so therefore these patients will have no germinal centers in the lymph node. Tonsils will be very poorly developed. So we asked the patient to open his mouth. His tonsils were not developed. So that's a very, again, classical clue that yes, it can be a case of Bruton agammaglobulinemia. Of course, the confirmatory method of choice is mutation testing, for which we have to do Bruton tyrosine kinase testing by whole exome sequencing. But because this is a today's case only, so we have not done that. We are waiting for the report. But yes, looking at this flow cytometry, we can very safely say that this is an agammaglobulinemia, and that is why the patient is having recurrent infections. So guys, the take home point is, so primary immunodeficiencies are common. You should not miss this. Okay, so whenever a newborn child or a child presents with recurrent episodes of infection, always work them up for primary immunodeficiency. Have a very strong suspicion in your brain so that you don't miss these cases, right guys? So with that, beautiful case of agammaglobulinemia here on flow cytometry here, right? Bye. By the way, before I go, try to answer this question, which can also be asked on this. I am sure you will be able to answer this, right? Bye.